Welcome to British BioMedicine Institute. Today I, Dr. Pramod Khatri, is going to represent a simple topic named as urinary system. So after studying this chapter, you will be able to name the part of the urinary system and discuss the function of each part. Define combining forms using in building words that relate to urinary system. Identify the meaning of related abbreviations and name the common diagnosis, clinical procedures, laboratory tests used in treating disorders of urinary system. List and define the major pathological conditions of the urinary system. Explain the meaning of surgical terms related to the urinary system. Recognize common pharmacological agents used in treating the urinary system. So urinary system is also known as excretory system. It helps in maintaining water balance. It removes waste product from the blood by excreting them in the urine. And urinary system consists of kidney, bladder, urethra and ureter and meatus. So the function and the structure of kidney are bean-shaped organ which are located in the retroperitoneal portion of abdominal cavity on either side of vertebral column. There are two primary functions. The main function is to form urine for excretion, to retain essential substances the body needs in process called reabsorption. Kidney filter about 1700 liters of blood daily in average adult. So this is a structure of a kidney, and the part of the kidney are cortex, which is the outer protective portion, medulla, inner soft portion, and ileum. It is a depression located in the middle of the concave side of the kidney, while blood vessels, nerves and ureter enter and exit the kidney. So upper part is known as medulla and ileum is located in the lower part, and cortex, which is a protective portion. Urine is produced by the filtration of the water, salt, sugar, urea, creatinine, uric acid. Each kidney contains more than 1 million nephrons, which are the functional unit of kidney. The blood flow through the kidney and it will enter into the renal artery to the arterioles. Then from arterioles it will move to nephrons, and from nephron it will move to renal corpuscles, which has a group of capillary called as glomerulus. The glomerulus filter fluid from the blood and is the first place where urine is formed by the kidney. This is the structure of the glomerulus. Blood flow through the glomerulus at a constant rate. Each glomerulus is surrounded by capsules known as Bowman capsule. The blood then passes into the renal tubules where some substances are reabsorbed and remaining become urine. The flow of urine. It will flow from glomerulus to the renal tubes, from renal tubules to renal pelvis, and from renal pelvis it will go to renal calces and it will again move to ureter. The filtered blood exits the kidney via the renal vein. The renal tube carry urine in two ducts in renal cortex. Ureter. It is approximately 6 to 7 inch long tube which is attached to each of the kidney. It is made up of 3 layers of tissue. First one is smooth muscles, second is fibrous tissue, and third is mucus layer. Peristalsis, it is basically a rhythmic contraction of the ureter smooth muscles which help to move the urine into the bladder. Urinary bladder is a hollow muscular organ that stores our urine. The sphincter muscle holds the urine in place. It can hold up to 300 to 400 milliliter of urine before emptying. The wall contains epithelial tissue that stretch to allow the bladder to hold twice its capacity. The trigone is a triangular area at the base of a bladder where the ureter enter and urethra exit. So urethra is basically a tube of smooth muscles where a mucus lining that carry urine from the bladder to the outside of the body. The female urethra is approximately 1.5 inches long and it opens through the medius, whereas male urethra is approximately 8 inches long and it passes through 3 different regions: prostate gland, second is membranous portion, and third is penis. Excreting urine is known as voiding or micturition. So now comes the combining forms. Cali is calyx, cyst is your bladder, glomerule is glomerulus, meto is meatus, nephro is kidney, pile is renal pelvis, and ren is kidney. Trigone is trigone, urine is urine, ureter is ureter, urethra, and vesic is your bladder. ADH full form is antidiuretic hormones, whereas AG is your albumin globulin. AGN is your acute glomerulonephritis. ARF is your acute renal failure. ATN is acute tubular nephrosis. BNO is your bladder neck obstruction. BUN is your blood urea nitrogen. CAPD is basically continuous ambulatory peritoneal dialysis. Cath is your catheter. CI is your chlorine. CRF is your chronic renal failure. Cysto is cystoscopy. ESRD is end-stage renal disease. ESWL is extracorporeal shock wave lithotripsy. HD is hemodialysis. IVP is your intravenous pyelogram. K plus is potassium. KUB is kidney, ureter and bladder. Na, everyone is aware, sodium. pH is your power of hydrogen concentration. I hope you are aware. And PKU is your phenylketonuria. RP is your retrograde pyelogram. SG is your specific gravity. UA is your urinalysis. UTI is urinary tract infection. And VCU is your voiding cystourethrogram. So now comes the diagnostic procedures and laboratory terms. Urologist is basically a physician who specialized in disorders of male and female urinary tract and male reproductive system. So the common test will be urinalysis. It is basically an examination of urine to its physical and chemical properties. It is obtained from the subjects who fill a specimen container or by urinary catheterization. So the characteristics of urine are: normal urine is straw color and it is clear. The normal specific gravity SG ranges from 4.5 to 8. Specific gravity measures the amount of waste, minerals and solid present in the urine. So abnormal findings in the urine are caste, glucose, albumin, PKU, phenylketonuria, or bilirubin, blood, and ketones. So now comes the types of catheter. Foley catheter. It is an indwelling catheter held in place by an inflated balloon in the bladder. Condom catheter is external catheter which consists of a rubber sheet placed over the penis. Now comes the blood test. The blood test which can be used are blood urea nitrogen or creatinine clearance test. The presence of high amount of urea or creatinine in the blood show that the kidney is not properly filtering these substances. Now comes the imaging test. It includes cytoscopy. It is basically a tubular instrument used to examine the bladder. And intravenous pyelogram, X-ray of the urinary tract after a contrast medium is injected into the bloodstream. Cube. It is an X-ray of three parts of urinary tract, basically your kidney, ureter and bladder. Renal scan. We can use radioactive imagings to identify the kidney disorders. Now comes the urinary tract procedures. Patient can undergo for dialysis. It can be hemodialysis. Basically, it is a process of filtering blood outside the body in an artificial kidney machine that returns the blood back to the body after filtering. And it is available in a picture is visible where a peritoneal dialysis is being conducted. It is in peritoneal dialysis there will be an insertion and removal of dialysis solution into the peritoneal cavity. And ESWS is extracorporeal shock wave lithotripsy. It is basically breaking down the urinary stone by using shock waves from outside the body. So now comes the pathological terms for inflammatory and infectious disorders, which consist of UTI, urinary tract disorder, glomerulonephritis, nephritis, nephrosis, hydronephrosis, and PKD, polycystic kidney disease, nephroblastoma, and cystis. So these are the inflammatory or infectious disorders. The term used to describe difficulty in urination are anuresis, polyuria, dysuria, inconsistency, anuresis or oliguria. So in anuresis there will be no urine output, whereas in dysuria there is a painful urination. In anuresis there is a lack of bladder control. In polyuria there is excessive amount of urination. Inconsistence means involuntary discharge of urine or feces, and oliguria is a scanty or little bit urination. So now comes the surgical terms, the part of urinary system which may be removed surgically. Nephrectomy, removal of your kidney. Urectomy, removal of ureter. Cystectomy is removal of your bladder. Surgical repair procedures are pyeloplasty, where we can repair the renal pelvis. Cystoplasty, we can repair the bladder, and urethroplasty, repairing of urethra. A urostomy is a creation of artificial opening in the abdomen through which urine exits the body. So the other surgical procedures are nephrolysis, where the removal of adhesion in the kidney. Nephrolithotomy is the removal of kidney stones. Nephropexy is surgical fixation of the kidney, and nephrorrhaphy, suturing of the damaged kidney. So there are various medicines which are available to treat the urinary system. We can use analgesics, basically they are pain relieving medicines. We can use antispasmodic medicines which helps in relieving your spasm. And antibiotics, they helps or they inhibit the growth of microorganisms. And diuretics can also be used where they helps in increase urine output. And antidiuretics which can decrease urine output. So now I want you to apply your knowledge and you can provide your answer in our YouTube comment section. Complete the following urinary system flow chart by naming the structure in descending order. So first one will be urine. Urine will be filtered by the kidney, then it will go to ureter, then it will go to bladder. After bladder, it will go to urethra, and from urethra, it will go to meatus. Following a severe injury, Mr. Hudson is told by his urologist that he will need a surgical procedure that allows urine to exit the body through the opening of the abdomen. Which of the following procedure will Mr. Hudson have to perform? First one is urethrotomy. Second is ureterotomy, and third is urostomy. So I hope you are aware of the answer. So the here answer is C, urotomy. Susan was diagnosed with a bladder infection and given a medication to treat the infection, but she did not take it. Failure to treat a bladder infection may lead to the following conditions: A. Kidney infection, B. Cystitis, and C. Bladder cancer. So here the answer is your A. It can lead to kidney infections. If an individual were to have a drastic drop in blood pressure below normal, which of the following would you expect based on what you have learned about renal system? A. Increase in urine production, decrease in urine production, and no change in urine production. So I hope you are aware of the answer. Here the answer is B, decrease in urine production. So this was all about the topic named as urinary system. I hope you have gained a lot of clinical information through this presentation. Please like, share, subscribe our YouTube channel named as British BioMedicine Institute. Good luck, goodbye.